All right, folks, gents, it's time for another show. It's time for pre-cals. What's going on today?
Hey, let's do it. Today we have the executive leadership team from NeuroValence. We have Dr. Jason McCune, who's the chief executive officer, long history in neurostimulation, and now he's bringing a new product to the market, along with Kate Willis, who's the vice president of commercialization. Has a history of being in that neuro stimulation market, and together they are bringing this new product called Modius Sleep that is designed to help patients with insomnia. So we're excited to hear what they have to tell us today. We know that this is a very nuanced patient population, and the treatments are sometimes difficult to find the right combination for a patient to help them get some sleep. So excited about another new product on the market.
Insomnia is such an elusive disorder. Trying to treat it can be so tough, and who I don't think any of us want to take medication if we can help it. So it's fascinating to get to have these guys on. I mean, I was just looking at the numbers. Depending on the research you look at, it's 10 to 30% of the population. So, give them some solution that's not going to be medical, that maybe could even be paired with CBTI. We'll have to ask about that, but I'm looking forward to hearing what they have to say.
All right, gents, shall we go to the show?
Yes,
Go to
sir.
the show.
All right. Now, a word from our sponsor, MedBridge Healthcare. MedBridge Healthcare is a leading provider of sleep lab management services and home sleep apnea testing. MedBridge partners with hospitals, healthcare systems, and medical academic institutions to offer comprehensive, fully integrated services for sleep
Lights
disorders.
out.
Welcome, everyone, once again to another episode of Sleep Tech Talk, the sleep podcast with your hosts and friends, Emerson Kerr, Robert Miller, and me, Dr. Gerald George Mannikarote. Once again, folks, another fantastic episode. But before we jump into that, just want to say thank you so much for all the views, all the listens, all the likes, all the shares. Folks, we've been growing, and as we are recording this episode, we are approaching 500,000 views on YouTube, and we can't thank you enough for that. We just say thank you so much. And a huge shout out to our sponsors for helping us get there. Thank you to you all folks out there. Please be sure to check them out and reach out to them as well. Now, so on to the show. We've got a pretty big show going on today. Robert, tell me a little bit about what's going on.
Yeah, we've got an expanded group today. We've got the some of the executive team with NeuroValence. We have Dr. Jason McCune, Chief Executive Officer, and we have Kate Willis with us, the Vice President of Communication. NeuroValence has a new product on the that's coming to the market. It is a newly FDA approved, I believe. You'll have to correct me if I'm wrong. Neuromodulation device for that does electrical stimulation for insomnia. So Dr. McCune, would like for you to jump in and tell us a little bit about yourself and about the product.
Yeah, no, thank you. It's my background's in medicine, so medical doctor in the UK, wide range of experience across emergency medicine into neurology and neurosurgery. But then in 2016, I got invited over to University of California, San Diego, to do research on neurostimulation devices. And that's actually really, and I'm sure we'll talk about it later, but that's really where the company and the product, Modius Sleep product, was actually first explored. And just to give a little snapshot of what we do, if you imagine like a deep brain implant or a vagus nerve stimulator, a lot of people would be pretty familiar with those. We tried to make a non-invasive or explore how a non-invasive approach could actually really transform that technology. So it goes from a last resort to being a first line therapy. And the other thing actually that fueled this is many of my patients, I was prescribing sleeping tablets to them and sedatives, and it just really, really frustrated me. So we thought, could we create something better? So when we realized that actually we could, and we can stimulate the deep parts of the brain non-invasively, then I set up Neurovalence as a UK company, and we started the long process of getting through all the trials and into FDA clearance.
Fantastic. And I know that we have another guest with us today. Kate, do you mind tell us a little bit about yourself and how you came to become a part of the Neurovalence team?
Yeah, thank you. I would love to share. So my background really is in neurostimulation, but I've been on the implantable side of things. So I've spent time at Medtronic working in neuromodulation in the restorative therapies. And I spent about 8 years with Nevro launching high frequency spinal cord stimulation for chronic pain and for diabetic neuropathy. And so from there, I spent a lot of time working in different commercial functions. And what I saw over the years was this really shift in patient sentiment where you saw this need for non-invasive therapies and also non-pharmaceutical therapy options. And so when Neurovalence was launching here in the US, I saw it as a great opportunity to really take all of my experience and background in neuromodulation, in medical devices, and then apply it to a non-invasive technology. So we're really excited to bring this to US, and it's going to be here this month.
That's very exciting. Thanks for sharing it with us. Doc, can you give us a rundown on how this worked? Because when you start looking at the name and behind it, you start thinking of the ear and things of that nature. How did this get discovered, and how does it relate to insomnia?
So in your, I mean, I'm sure you know this, and your audience will know this, but the central parts of your brain, so your brain stem and even up into an area called the hypothalamus, it regulates many things, many automatic things that happen in our bodies without having to think about that happening. So for example, your heart rate, your breathing rate, your kidney filtration, your circadian regulation, your thyroid hormone, all of those things are continuously being monitored and adjusted by the brainstem and the hypothalamus. So traditionally, if you were thinking of, oh, well, maybe we could improve the function of those neurons by, electrical stimulation, you would have always been thinking of an implanted device where an electrode is literally put right down into that cluster of neurons. But what we did was look at other connections that your body already has. And there's a lot of interest in the cranial nerves, particularly the vagus nerve, a lot of interest in that. But we actually looked at just other cranial nerves. And the one that we got really interested in was actually nerves in your vestibular system in your inner ear. And they actually come right to the surface just behind each ear. So just below the surface in that kind of hard bony part, it's called your mastoid, are the nerve fibers and receptors in your inner ear. So we can put a little electrode pad on both sides and actually activate those nerve fibers. We target one specific receptor, the macular gravity receptor. And with that stimulation being applied to the skin, we can actually activate then that cluster, those clusters of neurons in the brainstem and in the hypothalamus. So the potential is actually we could treat a range of diseases, but the first area that we explored really was looking at, could we improve circadian regulation through these known pathways? And again, I'm sure we'll chat about it in more detail later, but through a series of clinical trials, we've shown, clinically proven that actually this type of stimulation treats chronic insomnia. And then we were able to use that to get our FDA clearance, and doctors can now prescribe this instead of drugs for patients who struggle with chronic insomnia.
So, Doc, as a neurosurgeon, and just like you said, there could be a lot more applications. That's immediately where my mind was going. So my question to you is, why insomnia first? Why specifically that, and why circadian rhythms?
The people already know this mechanism exists. Whenever I say it, it's so obvious, but that's why you rock a baby to sleep. So we know the vestibular system influences sleep. It's also why kids fall asleep in the back of your car if you're driving along a kind of windy road. So it's a very profound and well-established connection. And there was a lot of research done from sort of internationally. A couple of universities looked at this, And the vestibular system integrates into some key areas. So the suprachiasmatic nucleus, the IGL, and even into the orexin system as well. And all of these are involved in circadian regulation, but even just your sleep wake transition. So knowing that pathway exists and knowing that it definitely influences your sleep, it seemed like a very obvious choice for us. But the one little caveat to that is those pathways also integrate into your metabolic control. So in some of our really early pilot studies, we were actually looking at metabolic control. But what happened was whenever we come back to the lab, all the patients had fallen asleep. So we were like wakening these people up in the lab because they were wearing one of our devices. And that's when we realized we must prioritize the Insomnia device because we know for sure this can really make a difference.
That's so awesome to hear. Robert, looks like you got a question.
Yeah, I do. Kate, I think I said vice president of communication earlier. I meant commercialization, by the way. And so you're bringing this new product to the U.S. Can you tell us a little bit about reimbursement, billing codes, sort of what is the pathway for a patient to be able to get this type of technology?
Sure. Yeah, I'm happy to share that. So initially, we're going to be launching directly to the consumer. We think that we have a broad audience. There's not you're hard pressed to find a patient that doesn't have an issue with sleep or insomnia. So we know that it's a very, very large market with really clearly unmet needs. So what we're going to be doing is launching direct to consumer through our website. Patients can come to neurovalence.com and complete a quick survey, a quick assessment, which will basically see if they're a good candidate for Modius Sleep. If they are, we're going to connect them directly to an online provider. And from there, they will see a physician online. And if they've qualified, they'll be given a prescription for Modius Sleep. That will get processed and we'll be able to send the device directly to the patient's home. So we really want to eliminate any pain points when it comes to getting patients access to this therapy. So when you ask about reimbursement coverage, we know that that's going to be a road ahead, but we are very optimistic. There is coding, there is payment, and we'll be getting coverage with Medicare on a case-by-case basis. We're also going to be working with some private payer groups to pilot out some studies and make sure that we can get commercial coverage in certain markets. But we know that it's going to be a case-by-case basis as we grow this market and really just build our brand awareness. The other thing to note is that we are on contract with the VA and the DoD system. So any veteran who's interested in this therapy can go to their local VA provider and mention Modius Sleep. And it can be also ordered through their prosthetics department and sent to the patient's home. So we have a nice pathway there for our veterans.
So, Kate,
I know that your current pathway allows for a patient to be able to come to your website and engage with the provider. But if it's a sleep physician who wants to order Modius Sleep for their patients, can they send an order directly to Neurovalence?
Absolutely.
Okay.
We are happy to work with clinics and providers directly. So if they have a patient that they believe could really benefit from Modius Sleep, suffers from chronic insomnia, they can send the prescription directly to us. We can process it and get the patient sent the product as well. So we're happy to go that route.
So both Kate and Dr. McKeown, a question for you is how would this work with, so currently with insomnia, apart from the medication or the pharmacotherapeutics that we typically hear about, what about cognitive behavioral therapy? How would Neurovalence work with that?
Yeah, I'll tell a little, maybe be a bit more descriptive about the device, because I'm sure people who are watching and seeing this for the first time, they might not even know what we're trying to do. But essentially, it's a little electrical device. It's a bit like a set of headphones, and it just pops on the head for 30 minutes a day. And a little electrode then attaches to the skin behind each ear. And one thing to note is this is not worn in bed, and that was actually a big thing for us. We didn't want something that was on your head while you tried to fall asleep, so that it's not disruptive or it's not going to get in the way of a good night's sleep. So typically patients wear this for 30 minutes when watching television just before they go to bed or in the hours before they go to bed. And what we actually found was patients really enjoy it, especially once they start to see improvements in their insomnia, and it actually then becomes almost part of their evening routine or their daily routine. But then to I suppose look at what other therapies this can relate to, we would actually see this as complementary with CBT. Certainly, you can do that no problem, and you can still use the device. There is probably a synergistic effect. It's the same with medication. If people are on medication, they can certainly use the device. But specifically in the trial, what we looked at was patients who were essentially just diagnosed or recently diagnosed with chronic insomnia. So our goal was to show that as a first line treatment, this absolutely has a positive effect. Therefore, doctors and patients should be really confident that this is a safe and effective treatment, and they don't have to resort to the drugs, sleeping pills, the sedatives.
Are you a sleep tech looking for new opportunities? Well, MedBridge Healthcare is one of the largest employers of sleep technologists, and they are growing. If you are a sleep technologist interested in a new position, potential paid relocation, or looking for a career advancement, consider a career with MedBridge Healthcare. Now back to the show.
Doc, one of the things that I wanted to help dispel before we went too much further is the difference between this and electroconvulsive therapy. Because some of our listeners, when we start talking about electrical stimulation, we go immediately to Hollywood and we start thinking of the worst possible scenario. So it's a difference in milliamps that are quite significant. But can you sort of take some of our listeners through that to help them understand the difference between the different types of stimulation?
Yeah, I can speak from experience. I used to prescribe and administer ECT. Unfortunately, sometimes that's just the only option that people have. It's an extreme therapy. It is absolute last resort, and it's what it does to the brain, the entire brain and nervous system, is very, very different to what we do. So I would say categorically, even if people think of this or associate it, it is nothing like that at all. It is absolutely the opposite, which is a very small, very safe electrical pulse that is just going into the surface enough that it activates receptors just in the surface below the skin in the inner ear. So it's a tiny, tiny, tiny little electrical pulse. It is super targeted, and yeah, I would say just it is. Whilst we deliver electricity in a way to stimulate the brain, it is extremely different from ECT.
Very good. So one question from the clinical trials, as far as sleep latency and then duration of sleep during the nighttime, what sort of outcomes did you experience through the clinical trials for this device?
The primary outcome that we looked at was the Insomnia Severity Index, and then after that we looked at the Pittsburgh Sleep Quality Index, PSQI. And it was really over a period of 4 weeks. So we advised patients to use the device once a day for 30 minutes for a period of 4 weeks, and we would assess every 2 weeks. So at baseline at 2 weeks or 4 weeks. And then actually we followed patients up right up to week 16, even though they had stopped using the device at week 4. And the other thing just to note is this was a double-blind sham control trial. So we actually have a sham device that delivers stimulation, but it's a different type of stimulation that doesn't really activate neurons in the brainstem. So it's an extremely robust study, and patients cannot tell what device they are given or what group they are in. So I suppose cutting it down a little bit, the key finding was that we achieved a 6-point reduction in insomnia severity, which is the target for what is classed as clinically meaningful. So we had set out to achieve that. And then also the 3, I suppose, most common things that are reported back to us would be, as you mentioned, sleep latency. So improved sleep latency or decreased sleep latency, less wakenings during the night, and then also just overall duration of sleep. So those 3 things, I'm sure it captures about 99% of the complaints that people have with their insomnia. So we were really excited and really happy to see those results come through.
That's great. I do have a follow-up question. The The device itself, is there any connectivity to an app? Is there something else for the patient to engage beyond the actual device itself?
So in our trials, actually, we did have an app, but that will be a medical device by itself, or software as a medical device. So the current version comes and it is entirely self-sustaining. You can there are little buttons on the side. You can increase and decrease the stimulation, turn the device on or turn it off. But actually what we will do, hopefully early next year, is have the app FDA approved, so that you could then connect the device and you can track. And we're really interested in that because we can actually get patients to log their ISI, and we can track it over time, and we can track all the associated sort of changes, like we're talking about sleep latency and sleep duration. So we're super excited actually to get that app hopefully on the market early next year.
Any chance that you have an EEG lead or two that would be included in the device at some point, so you can pick up actual sleep time?
We do get asked this actually quite often, and it's certainly something we would like to explore. The challenge a little is because it's worn before you go to bed. It's you might start to detect kind of changes that are suggestive of maybe going towards a sleep state. But the other area that we'd look at for sleep architecture is maybe something like a tracker that people wear when they're sleeping. So we could actually correlate that, and that's probably the next stage of the studies that we're looking at. One other, just while I'm on it, one other side of this is actually it's currently approved for adults, or sorry, cleared for adults, and we are working to extend that down. So our next step is trying to extend that to teenagers, because obviously nobody wants to give drugs to teenagers. And then further to that, we would be looking at exactly what you're saying, correlation with, sleep architecture and changes in your actual brain activity.
This is absolutely interesting and almost wild to hear these things, the advances of technology that have happened over the past several years. And Emerson, Robert, and myself, we've seen a lot of this, so it's fascinating. However, we are running out of time. So where can people get, I know you said, Kate, you said that there is, people can go to the website, but could you tell us, or give us a few more details about where can people get more information if they wanted to learn more, if they want to prescribe, or as Robert had suggested, if physicians want to get this for their patients, where do they go and where can they get more info? Yeah.
Yeah, absolutely. They go to neurovalens.com, and from there, they're going to click on the button that says Get Started, and they will take a short survey, a little assessment. And from there, if they pass that survey, they'll be forwarded to Beluga Health to get connected with an online provider. And from there, we will be able to get them a device sent directly to their home. And of course, they can speak to their own provider, their own physician about it, ask them about Modius Health. And we are happy to answer any questions that a physician may have and also take the prescription. So neurovalens.com is where the patients need to go.
Fantastic. Kate, Doc, thank you both so much for joining us. We sincerely appreciate it. It's been a great conversation.
Thanks for having us.
Yeah, thanks very much.
Yeah, wish we had more time, but who knows, maybe next year when the app comes out, then we could probably have you back on and hear more about what's going on.
Sounds good. That's the deal.
All right. Well, folks out there, thank you so much once again for joining us. And you've heard it here, new product. They're always here on Sleep Tech Talk, bringing technology to you. And until next time, we say, lights on. Okay, that was quite a show. That was a lot of brains packed in a short amount of time. Don't you agree?
Yeah, Jerry, I think, the exciting thing with this particular product is it's clearly another solution for our insomnia patients. I mean, there's so many frustrating things about having to work through CBTI and some of the other solutions. And this one sounds like something someone could easily adopt in their life. It was really a pleasure to get to hear about this new solution.
Well, and you know that I'm always up for new technology. So anything that comes to the market, love to learn more about it. And maybe sometimes we even get to know about it before, our listeners, when we see new things that are on the horizon. This is insomnia is such a tough treatment modality to me, because it's, trying to find that right balance of CBTI, pharmaceuticals, all of the other things that are out there. I'm glad that there's one more solution, and more importantly, I hope they can get to a place where this is a reimbursable item, pretty quickly, so that patients won't have to pay for it out of pocket.
I agree. It's so cool to see this and that too. It's a non-pharmaceutical intervention for patients with such a thing. And just like Emerson said, it is challenging when it comes to things like insomnia. What do you do for these patients? I remember back in clinic, we would have CBTI, we had the psychiatrist, we had the sleep physician, we even had a board certified PhD psychologist talking to those patients, and sometimes just nothing would happen. What else would you do? And we take it to the next level. And when you have something like this, it's just absolutely fascinating to see the options that are available now for patients.
I agree. One of the things I wanted to look as I was reading ahead about their product, I started thinking, well, how much electricity comes through here? And I asked them about it, and the difference is extraordinary. I mean, when somebody has ECT, they're looking at 800 milliamps versus maybe 1 milliamp with this. So when he was saying tiny, he was, he was spot on. But yeah, if somebody's concerned about this from a safety standpoint or a comfort standpoint, there's clearly a massive difference between this and what ECT would do to somebody. So, lay those fears aside. This is going to looks like it's going to be something very comfortable, very easy for your patients to adopt.
I just want to add one thing is listening to stuff like this and meeting people like this, it's just fascinating the direction that sleep health, sleep medicine, and sleep wellness is going. I mean, it's before it was in the realm of you had woo-woo on one side and you had hardcore medicine on the other, but there was nothing else. And now you see so many more advances that are just expanding to where we have been with implantables and things like this, which is an external product that helps insomnia. Come on. It's absolutely fascinating. And I'm just excited to see where the direction that the industry is going.
First time I'm pretty sure, and maybe the only time we ever used the word voodoo on this podcast.
Hey, listen, we're innovative even in our post show.
That's right. That's right.
All right, folks. I think it's time to close.
Yep, good stuff.
All right, folks out there, thank you all so much. We sincerely appreciate you being there for us. Huge shout out to our sponsors. Don't forget to check them out. And until next time, folks, cheers. Before we go, we would like to thank our sponsor, MedBridge Healthcare. MedBridge Healthcare is developing innovative inpatient, post-discharge, and population health programs to screen comorbid conditions, diagnose, and treat sleep disorders. Learn more about their innovative solutions and career opportunities at medbridgehealthcare.com. Once again, you can learn more about their innovative solutions and career opportunities at medbridgehealthcare.com.
Sleep Tech Talk is sponsored by ReactHealth. ReactHealth, headquartered in Sarasota, Florida, is a sleep and respiratory device manufacturer. Within our LunaPAP device line, each offering is FDA approved, encompassing CPAP, APAP, bilevel, and bilevel ST models. Our thoughtfully selected array of PAP interfaces and accessories complement our LunaPAP device line while accommodating diverse patient requirements.